We're moving to our EP subsection of the morning, and I'm pleased to invite Sunny Kapoor, who is one of our clinical cardiac electrophysiologists and really a leader in our atrial fibrillation center, who will talk to you about management of atrial fibrillation, which I think vexes us all since it's so common in most of the patients we see, and a big topic for the boards, and then also touch on management of other common supraventricular tachycardias. So Sunny, thanks very much.
Wonderful. Thanks so much, and good morning to everyone. Like Dr. Desai said, I'm going to be speaking about atrial fibrillation and other common supraventricular tachycardias. I have no disclosures relevant to this topic. And so our objectives today in the next half an hour will be to talk a little bit about the basics of atrial fibrillation, including the physiology and the management. And because it is such a clinically important topic, we'll spend the majority of our time talking about atrial fibrillation. We'll then spend some minutes at the end talking about the physiology and management of other common supraventricular tachycardias. And one of the most complicated things about this area is really the definitions, the semantics. And so we'll go over a little bit of that. Just to give a framework, as I think we're all aware, the cardiac conduction system is a relatively well-preserved and a relatively well-defined system that allows for electrical and mechanical activation of the myocardium. The conduction system for most folks starts in the sinoatrial node, where internodal fibers carry the electrical signal to the atrioventricular or AV node, and then down the His-Purkinje system in order to allow for ventricular activation. Now, we oftentimes define arrhythmias based on where in this conduction system a lesion or a problem is occurring. Now, of course, clinically, we don't always know that. We don't have insight into what's going on in all cases, but in terms of an organization rubric, it's the most commonly used way of classifying arrhythmias. Supraventricular tachycardias are the group of arrhythmias that occur when the problem occurs above or at the level of the AV node. So rapid heart rhythms occurring above and at the rhythm of the AV node. Now, if you think about that, the most common supraventricular tachycardia by that definition would actually be atrial fibrillation, which of course occurs in the atrium. But atrial fibrillation is so clinically important and unique that we oftentimes bring it out into its own diagnosis. Now, there is a cousin of atrial fibrillation, which we're all familiar with, called atrial flutter, which we'll touch upon briefly. There are other, what we would call regular paroxysmal supraventricular tachycardias, of which a couple of the most common diagnoses include atrial tachycardia, AV nodal reentrant tachycardia, and AV reentrant tachycardia, or accessory pathway mediated tachycardia. Now, we oftentimes colloquially use the term SVT and are oftentimes referring to these three diagnoses, or regular paroxysmal supraventricular tachycardias. But in fact, the semantics are a little challenging because technically an atrial fibrillation is a supraventricular tachycardia, even though we cluster it in a different diagnosis. So let's spend some time now talking about atrial fibrillation because, again, that is clinically the most common thing we encounter. So just to review the basics, atrial fibrillation occurs when the normal electrical impulses of the atrium are overwhelmed by disorganized electrical impulses. Now, what happens then is that the normal atrial electrical activity, which as we all know is inscribed on the EKG as seen in the purple arrow by a P wave, is lost, and disorganized chaotic electrical activity or fibrillatory waves as seen in the red arrow are present. Now, the downstream consequence of that is an irregular penetration through the AV node into the ventricular system, which gives an irregular QRS pattern on the EKG and an irregular pulse. And of course, that irregular pulse is the pathognomonic definition for atrial fibrillation. Now, the reason we spend so much time on it, the reason we deal with it so frequently is just because it is so common. The estimated prevalence is upwards of 3% in the United States, and it very much is a disease of aging. So as the population ages, there's an increasing prevalence of atrial fibrillation. The incidence doubles approximately with each decade of life after the age of 55. Certainly, as we get into our 70s, 80s, and 90s, the prevalence of atrial fibrillation is very, very high. Now, because it is so common, it is something that we know that we have to deal with. And in fact, if you look at the projected trends for atrial fibrillation prevalence, it's a little bit striking about how much it's projected to increase over the coming years. What's shown here in this plot is by different regions throughout the world on the x-axis, the estimated prevalence of atrial fibrillation. First, in terms of current estimates in the blue dots, and then in the orange dots, the estimated prevalence based on population projections for 2050. And what you can see is in each major geographical category that's represented, the United States, Europe, Africa, India, so on and so forth, there is an expected dramatic increase in the prevalence of atrial fibrillation. Atrial fibrillation is increasing and increasing throughout the world. We used to say that atrial fibrillation was a global pandemic. Of course,